Are you gonna pull up my thing?
Sure. Oh, wait a minute, we gotta get to share though, hang on.
So while she's pulling that up, I'm Sara Lynn. My maiden name's Johnson, and I put my long name on my card because my business is Mojo Pelvic Health. If you've heard of us, technically we're Moses and Johnson, shortened as Mojo. So Mojo is actually a play on our names. So I keep my maiden name in there, but my name's Sara Lynn Fultz. I am a physical therapist, but I'm also one of the co-founders and co-owners of Mojo Pelvic Health. We have 5 what we call core locations throughout the Mid-South. We got one in Midtown, one in Germantown, technically Cordova, one in Collierville, one in South Haven. We got one in Jackson, Mississippi, and then we're also inside 5 different doctor's offices. So what we're going to talk about today is pelvic health, and it may be something that you may or may not have heard of, but every single person in this room has a pelvis. So it applies to every single person in this room. Men, women, children, even. This really applies to everyone. And that's part of the misconception about pelvic health. And when it first started, it was actually called women's health because it was focused on women per se. So, all right, go to the next one, please. So this is me. This is why I do what I do, is that precious soul right there. That's my daughter, Sarah Grace. We went the double name thing with her too. Growing up, I swore I would never do that to my child, and that's exactly what I did. So I went to UT for PT school, went to Ole Miss for undergrad, and I teach at programs. I've even lectured here at Concord with these. So this is just my credentials, but we can keep going.
Trying to get it to go, I promise.
She's also the reason why some women might need pelvic health or babies, not her specifically, but just babies.
I'm trying to get it to go. You try something else. Okay, here we go.
All right, so this is just my business, Mojo Pelvic Health. That's our logo. And next. So this is something we don't talk about very much. And that's part of the problem, or that I wouldn't say problem, that's part of the issue, is not something we talk about. So things below the belt, especially in the Bible Belt, are just not issues that we discuss with each other, right? Like we didn't come into this meeting today and say, oh, when I laughed, I peed on myself. Or you don't go to church or to dinner with someone and say, I had sex with my husband last night and it was so painful. It's just not something that you discuss. Maybe in your close friend groups, and I'm hearing more and more of that, and I love to hear that. But just in general, we don't talk about it. And so that tide is changing, and I feel like more people are talking about it. I mean, hence I'm here today, which is great, just to spread the message. But that's one reason why a lot of people don't know, is we don't talk about it. It is very private. It is very personal, and these are conditions we don't share. But if your neck was hurting and you walked in today and you couldn't turn it, you might ask, or you might say, hey, I know this great physical therapist, or I know this great doctor, or this acupuncturist or massage, or you need to go do this or that. But no one sees what happens below the belt. No one sees that you're maybe wearing a pad, or no one sees that maybe you're hurting down there while you're sitting right now. Like no one sees that. So these conditions are just not talked about a lot. Okay. So what is it? It's basically physical therapy below the belt. It is for anything. The phrase I like to use is nipple to knee and everything in between. So any condition in this area, it can be back pain, hip pain. We'll talk more specifically in a minute about some conditions, but it's anything in that area. Okay. Anything. And when I say anything, I mean anything. Urinary leakage, bowel issues, pain with intercourse, prolapse for you ladies, men, this is men too, we'll get to that in a second, but basically it is physical therapy we are specialized to treat this area of the body. Not all physical therapists have this training, so this is additional training and education that we do after school. So I graduated with a master's in physical therapy, and I think in school I had maybe a 2-hour lecture on women's health. This was back then a long time ago. I graduated 21 years ago. So I had a 2-hour lecture. So it was just an exposure. So we don't know, most therapists don't know about this. You need additional training. So if you go into a clinic and they say they do pelvic health, just make sure they have some additional training in what they're treating, because they should have some additional coursework in it. But big picture, we're physical therapists. We treat muscles, nerves, joints. It just happens to be in this part of the body that no one likes to talk about. Okay. This is for men and for women. And that's a little misconception is this, we definitely see more women, but about 15% of our caseload are men. So this applies to you men out there too. The conditions we see men for are a little bit different than the women, but we get really good outcomes with our men too. So this is men, women, and even children. We have some therapists who are specifically trained in treating children as well. And those conditions are different too. That can be like bedwetting, constipation, some different issues like that for children. But across the lifespan, our bodies are changing. You don't have the same body that you did when you're 15. Can we all agree to that? I don't have the same body I did when I was 10 years ago in my 30s. It is constantly changing, and my body is not going to be the same in 20 years when I eventually go through menopause. It's going to change, and that's what we can help support that journey. We are, oh wait, go back, sorry. We're physical therapists, very private issues. It's a really good conservative option that a lot of people don't know about. So if you're trying to avoid surgery for certain conditions or recover from surgery for certain conditions, it is a really, really good option. I was just talking to one of my friends the other day who was talking to a mom in the stands watching their kids play sports. And she brought up the fact that she leaks urine when she pees on herself when she runs. And she's only been told that surgery was her only option. And it's just not the case. So luckily, I think she's going to come in and see us eventually, but that's what she's been told. And she just didn't know. She did not know there was a conservative option to help her. And so she was putting it off and putting it off because she thought she had to have surgery. It's widely underutilized. When I first started doing this 12 years ago, I started the first pelvic health clinic in the Memphis area. We had 3 or 4 therapists. My company now has 16 physical therapists doing this. So there is a huge demand. I think part of that is just word is spreading, but it is widely underutilized. And a lot of people just don't know about it. And because of that, they end up getting surgery, which possibly could have been prevented, or medications. I have gotten numerous women off medications for various conditions. And a lot of these conditions can turn into chronic conditions. So having pain one day, we can address that before it turns into chronic pain that lasts for years. So what is below the belt? That's the next one. Yes, please. So what is below the belt? A lot. There's a lot going on down here. There's some obvious things, but there's actually a lot in our pelvic cavity. There are our colorectal system, so part of your colon, like when you have bowel movements, the urinary system is in that area, the reproductive system is in that area, muscles are in that area, ligaments, nerves, what we call fascia. There is a lot going on down here. Your hip joints, the lower part of your back, there's a lot. So it's complex, and that's what we're trained to treat. We're not going to go into all that anatomy stuff. We're not going to go into all that anatomy stuff. I just put this in here to help you understand it is complex. There's a lot that goes on in that small area, and it really impacts our quality of life. I have treated men, you can go to the next one. I have treated men and women over the years who they don't go to certain functions. I treated a gentleman who was having urinary incontinence after prostate surgery, and he wouldn't go out of his house. For 2 years, he sat in his house, quit going to church, quit having lunch with his girlfriend because he leaked and because he went through about 12 diapers a day. We got him over the course of about 3 months. I got him to a point where he went back to church. He started having lunch again, and we got him to just wearing 2 diapers a day. So this can help, this can work. I worked with a young mother of 5 children who would not go to any of her children's birthday parties because she would have bowel accidents on herself. She was in her 30s, and she came in. I walked into her session one day and she was crying. I was like, oh no, what do these tears mean? And they were good tears, because she said she went to her son's birthday party for the first time because she had gotten control of her bowels again. So the feedback we get from our patients is it's life-changing. It is life-changing. It is when you have neck pain, back pain, hip pain, whatever it is, a lot of times you kind of suffer through it and go about your business or go about your day. But when it comes to your bowel movements or to urinary leakage or to really severe pain in that pelvic region, a lot of people just won't even leave the house. And so it really becomes a quality of life issue. So what happens to these muscles, specifically the muscles in the area, they can get weak, but they can also get really tense. And that's what a lot of people don't understand, is that we can also treat is there's also tension in that muscles. So a lot of my ladies and men come in thinking that my pelvic floor is just so weak. And actually their pelvic floor is really tense. So it's like they're walking around with a bicep curl all day long. I mean, how good would that feel, right? If your muscle is in this constant state of tension all day long. And that can cause problems. Then it doesn't work like it's supposed to. You can't reach, you can't do what you need to do. And it also can become painful, okay? So we help with that. We help gain that. And when there's an issue down there, this is what we see. This is typically how problems in the pelvic floor will present themselves, with urinary issues, with bowel issues, with sexual issues, with prolapse issues for women, and also with pain. So big picture, if you're having any of these type of issues, then it's possible you might have some issues going on in your pelvic floor. And these are some of the conditions, and this is not an exhaustive list by any means, but these are just an example of conditions. Pain, and when I say pelvic pain, that means anything in the pelvis. That could be pubic pain, hip pain, back pain, tailbone pain, rectal pain, testicular pain, penile pain, vaginal pain, you name it, anything in this area, groin pain, any of that can be associated with the pelvic floor. You ladies who have had really painful periods over the years, that could actually be related to your pelvic floor if it's too tense. Interstitial cystitis, it might be a condition that some of you have. It's painful bladder. Urinary dysfunction, we all hear about leakage and incontinence, but other problems can be that you don't go. And I've had numerous women that come in who can't go or can't get the flow started. Prolapse is another common condition, and based on the percentages, I'm sure some of you women have a prolapse in here, but it's basically where the rectum or the uterus or the bladder, something like that, starts to drop. Painful intercourse, and this is men and women, can be due to it. Pregnancy related stuff, so any kind of pain during pregnancy can be associated with, or can be something that we can treat. Postpartum conditions, and then bowel dysfunction too. And again, it could be leakage, but also could be constipation. So if the door doesn't open, nothing comes out. And basically that's what we help with, are those muscles. And these are just, again, not an exhaustive list, but common causes. Pregnancy can be one. The delivery of a baby can be one, regardless of whether it's C-section or vaginal, any kind of previous surgery. Low back pain. So there's a study that shows 80% of women who came in with back pain also had pelvic floor dysfunction, also had leakage. So it's really common. Any kind of nerve problem, a sexual injury, some type of abuse. Trauma is a really common one. Stress is extremely common. So that tends to be kind of the tipping point when I have patients come in, is when they have been through a stressful life event. I started treating a lady for urinary issues after her mom passed away. She had been taking care of her for 2 or 3 years, and then went through the stress of losing her mother, and then her issue started. But it can also be happy stress. I've also seen a woman who was planning her daughter's wedding, and we know how stressful that can be, but it's a happy stress, right? So stress is a really big one. any kind of infection, your posture. So just having poor posture, surgeries. So post-prostatectomy for you guys, that's a really common one. In one of the clinics I've previously worked in, we worked with a urologist who sent a lot of his men to PT, physical therapy for prostatectomy issues after prostatectomy. Hormonal changes. So our hormones change. As we age, our hormones change, and because our hormones change, our tissues change and our muscles change. Problems. So many things that can happen, but the hormonal changes can also lead to that we can help address. Okay. I'm not going to go into all these. I put these in here really just for your information. The main thing I want you to understand with these is all these conditions are common, but they're not normal. It's not normal to pee on yourself. It's just not. It's at any time when you cough, when you sneeze, it's not normal. And this is across the lifespan. I mean, we're talking ages ladies under 30, a third of us have leakage. Up to age of 60, 50% of women have leakage. It's so common. I mean, there's a whole industry on treating urinary incontinence with pads, with medications. I mean, you name it. It's literally $1 billion industry to treat urinary incontinence. And physical therapy has been proven to help with this. And this is in athletes too. And I've had CrossFitters come in complaining of leakage when they do box jumps or when they run. So this is not just childbearing women. Okay. Prolapse, this is like a hernia of the vagina. It's when the organs kind of start to drop. Again, it's so common. 40% of all women between the ages of 50 and 79. That means there's some of you sitting in here today that probably have this. Physical therapy doesn't, quote, cure a prolapse, but it has been shown to improve it and definitely improve the symptoms. You can go to the next one. Pelvic pain. So like I said, pain in any of that area of the body, 15%. 61% have no diagnosis. And that's part of the problem is a lot of people have pain in this area and they have no idea where it's coming from. And a lot of times it can be the muscles. But 25% of women spend 2 to 3 days in bed a month because of pain. That's a lot if you think about it. Think about having to take care of children or having to work, but you can't because you're stuck in bed because of pain. You can go ahead. Pregnancy, this is a really common one. And this is one we're actually in 5 OBGYN offices. And they are finally starting just to really understand the benefit of having physical therapy during pregnancy, because pregnancy itself changes our bodies and we can help with some of that dysfunction. You can keep going. And of course, postpartum. There's even some lingo that now calls the postpartum period the 4th trimester, because there are so many changes during pregnancy and delivery. We can help ladies recover so that they don't have long-term effects. So after C-section, vaginal delivery, it doesn't matter. You can keep going. And then for men, so this is definitely something that, I mean, a lot of women don't know about it, but definitely a lot of men don't know about it. But I have treated men very successfully over the years for various painful dysfunctions and bowel and bladder dysfunction. A lot of times when you don't even think that that's what it is, it can be. Okay. I treated a gentleman, it's been probably a year or 2 now, after a hemorrhoid surgery, and he was having a lot of constipation. And the constipation, I think, actually was leading to some of his hemorrhoid issues. And with our treatment, he got about 90% better just through some of the things that we did for his muscles and breathing. Okay. So what do we do as physical therapists? We're going to assess your full body and see what's happening. Are the conditions coming from the pelvic floor, the hips? Like, what's going on? Is it your posture? What is it? We can help with pain. We can help rehab your pelvic floor post-surgery. So I have a doctor in town who's so good about referring me patients after they have surgery. It's traumatic. If you had knee surgery, your doctor's probably going to refer you to physical therapy, right? But after having a C-section or a hysterectomy, which are major surgeries, doctors rarely ever refer people to physical therapy. And so that's a little bit of my soapbox, but there's so many changes and trauma that happen with surgery. We can help with that. Pain management, conditioning programs. So I've seen postpartum ladies who just want to get back to running, or they just want to get back to lifting. And that's something we can help with. Lots of patient education and advocacy. One of my patients told me last week, she said, you're like the meat of my healthcare team. Because when she comes to me with an issue, if I can't address it, I try to find her someone who can. So she's having some GI issues that I don't think are associated with pelvic floor. So I said, hey, ask your doctor about this, this, or this. And she did. And I think we figured out part of that issue. I've got one lady I'm treating, and that's exactly what happened. And it turned out she was positive for that particular condition. I can't diagnose those things. That's out of my scope, but I definitely can try to put you with someone who can help you. And then just screening and referral out, you know, if you're not appropriate, or if you are, we can help. Okay. And this is not just Kegels. So that's also a misconception. And historically, pelvic health PTs, that's all they did. They would just lay on a table and do a bunch of Kegels. So for you guys and women who don't know what Kegels are basically just tightening the muscles of the pelvic floor that help you stop the flow of urine. That's what Kegels are. That's an exercise. But what we do is not just Kegels. It's a part of it, but it is not all we do at all. There's so much more to it. We have to work on so much more coordination and endurance, and the muscles have to relax too. They have to tighten, but they have to let go. Okay. And this is just more that we do. So this is not just Kegels. Breathing, stretches, posture, education. We can retrain that bladder too. There's a lot we can do. All right. So I always get this question. So I kind of threw this one in here because everyone always likes to know. So what are your urinary habits and what's normal? So normal is that you only go to 5 to 7 times a day ish. Okay. About every 2 to 4 hours. So if you find yourself having to go every 30 minutes or every hour, think about how disruptive that is. If you can't sit through this meeting, or if you can't sit through a class, or if you can't drive from here to Nashville to go see grandkids, if you have to stop multiple times along the way, that's actually not normal. And we can help with that too. No nighttime voids. So actually after the age of 65, it's normal to get up once. After the age of about 75 or 80, it's normal to get up twice. But generally, I would say for this population, you shouldn't be getting up at night to urinate. So if you find yourself getting up multiple times, think about how disruptive that is if your body cannot sleep and rest and recover. What is not normal is what we call hovering. So you ladies, I know you do it. You hover. You don't want to sit on that public toilet. But what that does is it doesn't allow your muscles to relax. So you may not be emptying your bladder completely. And then jick peeing. This is another one. I know our moms taught us. Sometimes I even catch myself with my daughter. I try not to, but it's called just in case. I'm going to go just in case. I'm going to go to the bathroom before I leave home, just in case. Before I get on the road to go to work, I'm going to go to the bathroom just in case. But what that does is it teaches your bladder bad habits. And then you actually are training your bladder to go more often than you should. And then you shouldn't do pelvic floor exercises while you're urinating. So I get that question a lot. That's why I put it on here. Is people always say, well, can I do my Kegels while I'm urinating? And the answer is no. If you want to do it just to test to see if you can stop your flow, that's fine. But don't sit there and do 10 contractions, because then that actually has a poor impact on your bladder. And then no straining. You should not have to sit on the toilet and push and strain to urinate or have a bowel movement. Those muscles should just open and things should just flow. They should. Okay. Almost done. So what would you expect? Like to come to us, go to a physical therapist, what would you expect? Nothing is TMI. That's our slogan, is people come in and it's so personal and private. They don't want to talk about certain things, or they don't want to tell me certain things. And the reality is nothing is too much information. The more information I can know about you and your urinary habits or your bowel habits or whatever we're treating, the more I can help you. We treat in private treatment rooms. So we're not out in a gym floor talking about these issues. How uncomfortable would that be, right? If you're laying on a treatment table and your therapist is asking you, I mean, how many times did you get up and pee last night? It's probably not something that you want to talk about when there's someone beside you working on their shoulder. So personal, private rooms in a very safe environment. So we really try to create a personal and comfortable environment. We try to make it less medical. So all our rooms, we have nice paintings on the wall, and we don't have stirrups. We don't use anything like that. We try to make it very comfortable. We have lamps in the room. It's very individualized. Not everyone comes in with the same problem. So we meet you where you are. Our therapists are specialized. We really examine the whole body. We do a lot of hands-on techniques. So you're not going to come in and just do a bunch of exercises. We're actually going to get our hands on you and see what we need to work on. Lots of education. I mean, because this is an area that a lot of people don't know about, we talk a lot. I could literally lecture for days on this stuff. So it was kind of hard for me to pare this down, but I literally do teach for days on this. So we can tell you a lot. And then in Tennessee, you don't have to have a doctor's referral. So in the state of Tennessee, if you're seeing a therapist, and it's not just us, any physical therapist, you don't have to have a doctor's order for at least 90 days. And even then, we just have to communicate with a doctor. Okay. All right. So this is it. What do? It's commonly an issue in the pelvic region. It's men, this is women, this is children across the lifespan, and it's never too late. That's a question I get to. It's never too late. If you're 80 years old, we can help you. If you're 35, we can help you. If your surgery was 20 years ago, but you're still having issues, we can still help you. And I have seen men with prostatectomies literally 20 years ago. I've seen women with hysterectomies that were 20 or 25 years ago, and they're still having issues, and we can still help you. So it's never too late to start these services. Your body and your needs change. Like I said, what you need today is not what you needed 5 years ago or 10 years ago. So we try to meet you where you are. And then those are just kind of a summary of what we commonly treat. Go ahead. And that's it. That's part of my team. We are Mojo Pelvic Health, and we change lives. We really do. We change lives. So if we can't help you, then I know we can help someone who you know. Okay. And just the education of what this is and know that there's help out there is so empowering. And we have literally changed how doctors think about some of this too. We had a doctor we were talking to last week. One of her ladies was giving birth, and she said, "You've been to Mojo Pelvic Health, haven't you?" Because the way she was breathing and everything just kind of flowed. It was so good. She's like, "You've been to Mojo." So yeah, if y'all have any questions, I've got some flyers and some business cards, some things like that. If you want some more information, we're also online, social media as well.
I don't have a question, but I do want to say that you guys are very, very famous in especially the young mom circle.
Oh,
everybody
good.
knows who Mojo
Oh,
is.
thank you. Thank you for telling me that.
Did we learn something today?
Hope so. I teach at UT in the physical therapy program. The second year I did it, I went in and I'm just giving my spiel, and for them, I'm doing anatomy and there's pictures of things. And I look up and they're like, and afterwards, one of them came up to me and they said, "This is not what we thought we were looking at today." They said, "We didn't know this was about the pelvis." And so it was a bit of a surprise. They were like, "But it was good. It was good." But everyone's like, not what we thought. So if y'all have any questions, I'm going to hang out for a while.
I have a question.